Okay. So, Manika, you already know how to deal with the station because I know you. I think I have done, I think 1 or 2 sessions with you before also.
Yes, ma'am.
So yeah, so you know already how to deal with this with the stations, uh, and I know your progress, how you were in the beginning and how you are now. Before you were having some problem in understanding how to deal with the station also, but now you don't have this problem. Now your only problem is time management.
Yes, ma'am.
Yeah, and why it happened? That because you were thinking, I think.
That is the reason why, ma'am.
Yeah, you were thinking that what you have to say, and this thinking thing should be done in the 2 minutes when you had
Oh,
this 2 minutes. So
okay, ma'am.
you should think everything and write in your bullet points. That's why I'm emphasizing on these 2 minutes. That initially, when we were going for exam, we were having 1 minute only. So we were not having 2 minutes. So now this 2 minute time is good enough that
Yes, ma'am.
you can write, you can decide what you will talk in the next 10 minutes, and then so that you don't have to think, stop in the middle and think. You have to talk fluently,
Okay, ma'am.
one after another, like you did when you were under stress and your
Hmm.
time was about to finish. You started to talk. This is the thing I wanted to do it from the beginning.
Okay, ma'am.
So do not stop to think. Talk like fluently, and like you know what you have to say, and you have already decided in your 2 minutes that what you have to say. So I want to know what you have written important issues in this scenario in your 2 minutes.
Yes, ma'am. I have written the name of the patient, age,
Okay.
and primary,
Mm-hmm.
and the HIV positive in the 12 weeks confirmed by lab, and this tests and all, viral load every trimester, and the CD4 count I have forgotten, ma'am. But I have written
Mm-hmm.
CD4 count.
You
That
have
also.
said it that we will
No,
check
okay,
your
ma'am.
immunity, yeah, which
Yes,
is
ma'am.
CD4.
Then the treatment should be started within second trimester,
Mm-hmm.
and this will be followed up with the liver function test, everything,
Mm-hmm.
and that also I have written.
Mm-hmm.
Then gum clinic, referral to gum clinic, and partner to be informed, and partner to be
Yes,
tested, and the breastfeeding I have forgotten, but when I was telling, I told, ma'am.
yes, yes.
The
So
drugs complaints.
yeah, compliance. Okay.
Yes, ma'am.
And side effects maybe of some of the medications needs to be informed also. And what can happen during the pregnancy, like the follow-up of pregnancy. I think there are some medications which can cause increased risk of gestational diabetes, right?
Yes, ma'am.
Yeah.
So
So it needs
OGTT
to be
also.
tested.
Yes, ma'am.
Yeah.
Yes, ma'am.
And
That.
I think there is um, a little bit increased incidence of preterm labor also. But anyway, when because you have, if you will revise your guideline, the knowledge part will come from there. But let's talk about the technical part of this scenario. Like you have said a lot of things, enough to pass the station, but the only problem is that when like you lost like at least 3 minutes, because you were trying to think in the beginning. But then you took your pace and you started to talk without any gaps, without any breaks. You were talking and talking and talking. This is how I wanted it from the beginning. But anyway, it's just starting. When you will be in the stress of exam, you will talk.
Okay.
Yeah. So how
Yes,
was it
ma'am.
in November? You were talking.
In the exam, I felt like that only, ma'am.
Mm.
When I'm preparing in the house, it will be different and difficult.
Yeah.
There, as you told, everything came in a flow, ma'am. I
Yes.
felt the same.
So I'm not very much concerned about this problem also, because when I can see that you can do better under stress. So when you will be under stress of exam, you will do it.
Thank you, ma'am.
Okay.
It happened.
So
It happened, ma'am. You are right.
So it's a state. So don't be very much stressed about that you are not finishing in
Mm,
time or what. You will do
mm,
it. So it's a
mm.
station of breaking bad news. So you have to follow the steps of breaking bad news, which you know that you have to give first shot that I don't have a very good, um, uh, what you call it, news for you. Or you can say that it's, so I have some disturbing news for you. Or you can say that I don't have a very good news for you. Uh, so this is the first warning sign. So she will become worried, you know. And after that you can say that I have to give you this report, like it's because it's confidential, and I cannot call anyone else, so I hope you understand. So shall I tell you now? So you see, she will say that if she's ready, she will say, yes, I'm ready, you can tell me. Then you can just give her this news that the result came and this is your report. And I think you mentioned about the hospital number and the name of
Yes,
the
ma'am.
patient, the full name of the patient, which is a part of safety
Mm,
procedure you need to follow. Yeah, and this is your report and it's confirmatory report.
mm.
So it's, I'm not telling you the initial report, it's confirmatory report. It's already confirmed by another test from the lab. So I'm very sorry to be the bearer of this news that this is what it is. Like you said, that you have a virus in your blood called HIV virus. And then I think you ask the agenda from the patient also. You ask that is there anything else that this is how it is? You break the bad news, but initially you ask one thing which I wrote here, that do not ask her that what is her choice, that if she want to know the break, if if
Oh,
if
mm,
you want to break, if she want to hear the bad news first, or shall I ask you a few questions. So give her your agenda, tell her that I'm going to ask you a few questions first, uh, to um, to know better about you, so that I
okay.
can give you a better management for your
Mm,
problem.
mm,
So, may I ask you a few questions first? But if she insists and she will say, no, I want to know the result first, then you can say that, okay, then I'll ask you questions later on and I'm going to tell you now. But if she's not insisting on it, you will give your agenda. Your first preference should be to ask few questions, which I always like. So ask
okay.
few questions.
Mm,
Unless
mm,
she insists, then you
mm,
cannot like force any patient. But if she is not insisting, just go on and give what you
mm.
want to do.
Yes.
So it is good that you ask about her agenda, and uh, and yes, yes, this is the only the point in the beginning what I wrote, that just tell her what you want to do. And then after that, like so this is breaking bad news. You break the bad news initially, not initially, but you ask few questions from her history. Now targeted history. Now targeted history, uh, she is 12 weeks pregnant, right?
Mm,
So
mm.
you ask about her pregnancy now. Actually, she told you that she is only having a little bit of nausea,
Nausea.
but no more vomiting. And I
Mm,
think you asked about her pain and bleeding or any other problem that she is having. And she said, no, I don't have any problem. I'm not
mm,
feeling sad also. I'm actually very happy because I'm pregnant and this is a
mm,
planned pregnancy and all these things
mm,
she told you.
mm,
And yeah, and she was on folic acid. You even ask her because it's a planned pregnancy.
mm,
And she told you that this is her husband. She said
mm,
the word of husband.
mm.
Previously, Dr. Anam, I think you used the word of boyfriend. No, we use here the word is partner, because you don't know that this is her husband or not. So just use the word on the safe side, partner,
Mm. Yes.
always. Anyways, I just wrote it, but I forgot to say in the previous um, station. Yes. So, and then after that, you ask about any health problem, medications, if she's using allergies. Social history is very important in this scenario because it's sexually transmitted infection. So you ask about smoking, alcohol, and drugs for fun, and you came to know that she had a chlamydia infection before. So you know that from where this infection is coming, right? From her, maybe most probably from her, it's most like it's not blood transfusion. So you even ask that she's sharing any needles. So she's not, she never had a blood transfusion. Uh, so most probably it's the same source from where she got her sexually transmitted infection before. So you even ask her about her support, that how your current partner is supporting, and is very supportive. You even ask about her occupation, her partner occupation, and how are things at home, and how she's feeling. And if career partner with her since how long, to know that. I think you asked about her previous partner. Is this the same partner? So you said no, she was another. I was with another partner that I got this
You
sexual.
told.
So you have an idea about her sexual behavior, high risk sexual behavior, that she had like few partners before. And I think you even ask her about the safe sex practice.
Yes, ma'am. Condom.
Yeah,
Yes, ma'am.
yeah, you ask her, yes. So with this point is also covered also. And you ask about the family history, blood workup, dating scan done, and history of blood transfusion. You ask about her blood group also. Some people are routinely asking about any objection for blood
Transfusion.
transfusion. Yes, this is their routine that they ask every pregnant lady, which I think is okay. This is good also. And ask her if anyone with her. Actually, this is the problem, that this cannot follow the routine breaking bad news, because she's having HIV, and which is confidential. But there is one thing good, that you ask about her partner, that if are you going to tell her, and he needs to be informed. And you told her straight after confirming name and NHS number, you did all this thing. And you said that I'm sorry, I'm the bureau of this news, some typical questions in breaking bad news. And you even asked that do you like to continue the consultation, and then you started your counseling. Then you mentioned about multidisciplinary team, and referring to HIV specialists and counselors. So this team of special doctors who will take care of you, you mentioned about it. And you even said that you need to be followed up by the consultant-led unit. And then I think you talked about the rest of her pregnancy, like she's 12 weeks, so second trimester, third trimester, and then at 36 weeks, we'll decide about the plan of delivery, like mode, place, and time of delivery. You talked about her blood test, like CD4, viral load, and starting the treatment. You talked about it. You talked about I think you didn't talk about DDM screening, but you talked about other
Yes, ma'am.
STI screening. Yeah. What is this FT monitoring? Fetal monitoring, I think. Yeah, like the scans and everything. Yeah, maybe.
Baby.
And then you talked about repeating test at 36 weeks. And if the viral load, you said, is less, you mentioned all these things. If the viral load is less than 50, then she can be delivered vaginally with all the precautions, and you just have to mention about a little bit of precautions. And if she has ruptured a membrane, then it can be induced as soon as possible. No breastfeeding, you said. Maybe she needs like a cesarean section, you mentioned. And all these measures reduces the risk of transferring infection to baby, because she was worried that if but you have to tell her, counsel her, that if you will do all these things, then the risk of transmission to the baby will be from 40 in 100 to less than 1 out of 100. It will be less than 1%, but you have to say less than 1 out of 100. So you even encouraged her to talk to her husband and get him tested, and emphasize the use of condoms, and talk about contraception even after delivery with the condoms. Even if she will use contraception, she still has to use the condoms also. And talk about the need of neonatal. You even said that you will refer her to the pediatric doctor, who will tell you about that, how they are going to
treat the baby.
follow up and treat the baby. Yeah. And you talked about patient information leaflet, support groups, follow up appointment with consultation. And there's one more good thing that you talked that, yes, tell the partner. Yeah, LFTs also, CBC and everything, the blood test that needs to be started before this treatment. And then during the course of the pregnancy, this test will be repeated and again at 36 weeks, and then we will decide how to deliver the baby. So you said
Ma'am,
effort.
I have done this so many times, ma'am.
Yeah,
That's why.
yeah, you have said
Even
effort.
then, I am not able to finish it in time. That's a pitiable thing, ma'am.
Yeah,
I have done.
you have to use your 2 minutes wisely.
Okay,
That I
okay,
must say, and then gain the confidence.
okay,
But in the exam, because
mm,
you will be under pressure of the exam, you will do
mm,
it. You said
mm,
all the things, and
mm.
I'm not worried. You can do it, of course,
Thank you,
and
ma'am.
you know how to take the station now. And any station like this, you can take it also, like hepatitis B, HBs antigen in pregnancy, HIV in pregnancy, things like this, and you know how to deal with the pregnancy cases. Like you have to ask history of current history, history of current illness, like what she's having now problem, history of presenting complaint. Then before 12 weeks, what happened? Then after 12 weeks, second trimester, third trimester, delivery, after delivery. So you know how to, you know, you know the format. So it's okay. So I think the new girl is not able to join, although I sent her. Mm,
Dr. Samir, I have one question.
yes, yes. Now let's discuss.
Yeah, American, she mentioned something that it is confidentiality. It's okay, confidentiality, but she mentioned something that if you don't want the GB to know about the case, but I think the GB should know about HIV.
Yes, the GP should know. She said two things. Dr. Manikin, she mentioned that which I like also. One thing, you are right, you mentioned this point that GP needs to know. The second point is, she said that if you are not going to inform your partner, then we will inform. So it is better for you to inform him. So which should be the case. That is true. That she cannot keep this from her husband or from her partner, because this and he needs to be tested. And she mentioned also that he needs to be tested, and if he's found positive, then he needs to be treated also.
Yes, ma'am. GP has to be informed, ma'am.
Yeah, GP needs to be informed. Yes.
Okay, ma'am. Thank you, ma'am.
Yeah, but confidentiality, yes. Maybe if she does not want any other nurse to be with her while she's, or any other person to be with her while you are informing her, this is her right. And you can, I mean, it's not important here to offer someone to be with her for her support. So this one is confidentiality, but not to inform the GP and not to inform her husband is not part of the confidentiality, because HIV is a public problem. The other people can be involved also. So that's why the one who can be involved needs to be informed also. And because GP will be following the case after the delivery also, because she needs to be followed up after delivery. So that's why GP is needs to be informed, because he's part of the care of any HIV patient.
He is the part of the MDT also. He's in the
Yes.
loop. Yes, ma'am.
He should be kept in the loop, because he will follow her after delivery anyway.
Thank you, ma'am. Thank you, Anam.
Yeah, you are most welcome. Any other point that needs to be, Dr. Athil, Bushra? That you think that needs to be discussed in this scenario? This is a recall question also. Anything else? Okay, so we will stop here, and I think both of you have done well, and both of you can pass the exam. I have no doubt. You know, you just need to believe yourself that you can do it. From the time I started to prepare for my part 3, I knew that I will do it, because I know myself. But the timing is not decided by you. So either it is in this February or in May or in November. Like first time I appeared in the exam, I did not pass. But I knew that I will do it. I was not sure that I will do it second time. But I knew that even if it is not second time, but third time I will do it. If not third time, I will do it fourth time. You just need to believe in
Yes.
yourself.
Okay,
Yeah.
ma'am.
Doctor, we have 4 trials only.
Before we were having unlimited. Yeah.
Yes.
So it is
No,
now
before it is part of part 2. There is no part 3 before.
Yeah, but I was having part 2 theory and then I went for part 3. So
Yes, doctor, in the previous exams, when we finish the written, we go ahead for
yes,
OSCE. And
immediately
if we failed
after
in
that.
OSCE, if we failed in this OSCE, we should repeat the written
The
again.
written, yes, I know. It was very difficult, yes.
Yes.
Yeah.
But in this exam, we have 4 trials only. If we failed in all these 4, we should repeat the written again.
Athil, but it's not that bad also because it was really very difficult that if you fail OSCE, then you have to enter the exam again for the theory, which was very difficult, very, very difficult. Yeah. So, but if you even have 4 trials, I think that's not bad also. And most of the people who pass the exam, uh, they they are able to do it within 4 trials. But I have seen some of the girls, uh, they appeared like 4 times, 5 times, and then they passed in 6th time. So you should never lose hope, I must say. And if you are determined, it's only your determination. So if you are determined that you will do it, then I don't think it's a matter of 3 times, 4 times, 5 times. It will not be written in your certificate that you have passed it after 4 attempts, isn't it? So it's okay. Okay, good luck. And I'm going to select like out of you, maybe all of you, to offer a mini mock with me before you will go for the exam. Just remind me before you go for the exam. And if you want to attend my course, of course, it is there on the Telegram, all the information. This is how we will go the module wise. It will be once in a week and then twice in a week before the exam. So I think the people who are going for May exam, we should start it like once in a week only. No need to rush. But for the people who are going for February exam, I think just before the exam, I think in January, we should do it twice per week sessions to have more like practice before the exam. And when you have the mock exam, when I'll do the mock exam with you, and I think Bushra, I am going to do the mock exam with you, Dr. Bushra. Yeah, it is due. So this mock is very important because it will make you ready for the exam. Once you will do it one after another one after another one, you will be very fluent and ready for the exam. So it's better to do it like few days before you travel or few days before the exam. So anyway, good luck. I'm going to stop the share here. And thank you for joining, all of you. And few of you are not able to join, maybe because the link is not working or whatever, but it's okay. Next time I'm going to post it in the group so everyone can view.
Thank you, ma'am. Thank you so much.
Thank you very